I wanted to start by just saying how proud we are to have you working at Leeds Teaching Hospitals Trust. You've inspired thousands of people to sign up to the Hello, My Name is campaign and reconsider how they interact with patients every day. You will know that being patient-centered is one of our 5 values now as an organisation, and I know that's something you feel really strongly about. I just wondered if you could tell us a little bit about your story and what led you to the Hello, My Name is campaign.
So my story is quite a long and arduous one now, and it starts about 3 years ago when I was on holiday in California with my husband. We were having a lovely, well-earned break in the Californian sunshine, but I wasn't feeling very well. And a few days into the trip I started getting some really severe pain in my back. That got worse and worse and worse until I ended up in hospital. When we got into hospital, it became apparent that I was seriously unwell. My kidneys had stopped working, and the reason for that was that my abdomen and pelvis were full of tumours. So bang out of the blue, at the age of 29, I'd got a diagnosis of cancer. We didn't really know what kind of cancer it was or where it had come from, but the American doctors thought it might be ovarian. So we came home after some initial treatment in the States to try and work out what was actually going on. And that's where I started being a patient here at Leeds. I was admitted quite soon after a referral from my GP to the Bexley wing, and after a lot of tests and procedures and things, I was diagnosed with a very rare and aggressive form of sarcoma. So during that initial time when I was going through chemotherapy and just trying to get through accepting my diagnosis and getting my family through that horrible time, I kept myself sane by writing about my experiences. That was initially just a private diary, but by the end of my chemotherapy in January 2012, a lot of people encouraged me to share it as a book. So that's where I started sharing my illness. I went back to work at that point and realised that a lot of the things that I'd observed as a patient and experienced as a patient were really, really important to how we provide healthcare, and being patient-centered really meant a lot more to me personally, and how I acted as a doctor in my own behaviours towards patients, in my body language, in how I gave patients more time, how I took more care to break bad news, because of the experiences I'd been through. And all that kind of led on to really being a keen observer of my healthcare. Hello, My Name Is was born out of an experience in Leeds in August last year when I had a simple procedure to have the stents that drain my kidneys replaced. Unfortunately, that was complicated by post-operative sepsis, and at that time I noticed a lot of the healthcare staff that were interacting with me didn't introduce themselves, and it wasn't just one nurse or an occasional blip in the system. It seemed to be everyone, and that felt really wrong to me. It's the first thing we learn as doctors, is to introduce yourself to your patients. It's like a fundamental part of communication, and I couldn't really believe that it was happening. And the more I observed and the more I looked for it, the more I realised it wasn't happening. So I started tweeting about the idea using the hashtag hellomynameis, to try and encourage people to think about how they interact with patients, and how it's really important to think of the person behind the patient, and the start of that's by introducing yourself, about that human connection with people, about building a relationship, about allowing your patients to trust you. And that campaign sort of spread throughout the NHS very quickly, as an idea that everyone can do, that doesn't cost any money, and that can have a big impact on the experience that our patients have. So I was soon being asked to speak at lots of healthcare conferences, at lots of different trusts, and just a couple of months ago we decided that we wanted to try and make the idea fly in Leeds as well. So with lots of support from the executive team here, from the medical director, chief nurse and chief executive, we've really made the campaign come alive here.
Just to take you back a bit, before you were diagnosed and you were a doctor, a young doctor, what was your experience of being a doctor and how you perceived patients and how you said that when you were a junior doctor, it was you focused on communication. Could you just tell us a little bit about that?
So I think before I was ill, I was a fairly empathic doctor. I wanted to be a geriatrician, and part of being a doctor who looks after older people is lots of communication. We deal with breaking bad news, of often very significant diagnoses for people. There's often a lot of communication about the risks and benefits of treatment in the face of very little evidence, and there's lots of end-of-life communication planning in that scenario. So I did a lot of talking and communicating with my patients, and particularly their relatives, before I was ill. But I think one of the things that I perhaps did, and most junior doctors do, is focus on tasks and trying to get tasks done and jobs lists ticked off and things, and maybe not focusing enough on the person behind those tasks and why they needed to be done, and the importance of thinking about that person and maybe trying to communicate a little bit more with them about what's happening and why we're trying to make decisions, and what our focus of care should be for that person, and what their priorities are. I think you get a little bit stuck on the medical agenda sometimes, and that's how we're trained, unfortunately. Moving that focus back to the patient is really important in my view.
Just a broader question, how has your experience, your own personal experience, shaped your perception of care within the NHS?
So my perception of care within the NHS has obviously been influenced by my own experiences. I think I perceive care to be very variable within the NHS, and that's something that I think we all need to work upon. I've received some outstandingly good care at Leeds. I'm supported by some amazing clinicians and some fantastic nurses. But I've also received some care that hasn't been what I'd expect it to be. And that's gone from perhaps not having my pain adequately managed to communication that has been suboptimal and caused me quite a lot of distress and psychological harm. And I think we need to focus on that variability and try and get everyone up to the amazing standards that I know we can deliver within the NHS, and that's a big challenge for everyone.
It'd be interesting to hear some examples of that good care from your own point of view, what that means, and even the word care. For you, what has that meant when you've seen good care?
My experience of good care has been, across the board. I've had some really good experiences, and I think one thing that's very important to me as a patient is continuity. The continuity that, for example, my consultant oncologist gives me is amazing, and being able to see the same person every time is really lovely, and that means that you don't have to go through your story over and over again. That somebody knows you and knows your problems and knows how to deal with you and how to manage your problems appropriately, and that's really important to me. I think good care is when you feel looked after, when you feel that somebody is doing their best for you, that you are made to feel special and that you're important and your problems matter. And that can be as simple as somebody just holding your hand. For example, a couple of months ago I was really unwell. I was in a ward in Bexley Wing with really bad febrile neutropenia. My temperature wouldn't come down. I'd got through loads of antibiotics and nothing seemed to be working. I was in loads of pain and I was really frightened that I wasn't going to get better. And the consultant oncologist who saw me that Saturday evening just put his hand on my arm and said, "Kate, you're going to be okay." And just that human interaction and touch made me feel that he really cared and that he was doing his best for me, and that I mattered, and that he'd recognised my vulnerability and how scared I was. And that simple, isn't it? Everyone can do that, but that's as simple as I see care, really.
Why do you think a positive and personal introduction such as "Hello, my name is important to a patient"?
So I think an introduction from a member of healthcare staff is essential for a patient. It starts a relationship. It builds a human connection. It allows them to trust you and builds a rapport between two people. And I think it's also a little bit about power. And in the power stakes, as a patient, you're quite low down, and as a healthcare professional, they're quite high up, and that's because of information, and that a patient doesn't really know anything about what's happening to them and anything about this new scary environment of healthcare, whereas a healthcare professional knows lots of information about the patient, knows lots of things about their life and intimate details about them, and that power imbalance is very visible as a patient. And I felt that even though that I'm completely familiar with the environment, I've still felt low down in the power states. It's sometimes when I'm a patient. And just simply introducing yourself can just realign that power and try and get everyone on an equal level. So I think it's much more than common courtesy.
To somebody who hasn't heard of "Hello, my name is", which I'm sure there are very few people in the health service who haven't heard of it, but how would you summarise it for them?
So "Hello, my name is basically a social media campaign that is designed to inspire, encourage and remind healthcare staff about the importance of introductions in the interaction with their patients. And it's an aspirational campaign that is designed to inspire people rather than a protocol that somebody must do. It's about an internal behaviour and a value that people should feel that's important to them and how they behave when they're at work.
Have you been surprised at what a success the campaign has been?
I'm continually amazed and surprised about how much success the campaign's had. Every single day there's a new, somebody's doing something new with the idea, and it's just amazing to see it spread through the NHS. I can't believe that one simple idea that I had that came out of a conversation between me and my husband has had such an impact on so many people.
And just to expand on that, when you talk about all of the people who have been inspired about it, we're talking about people from the very top of the health service, like the Secretary of State for Health, right the way through. I don't know if you wanted to speak about that a little bit, and all the people who have been inspired and who have contacted you.
So there've been so many people involved in the campaign, and Jeremy Hunt mentioned it in a very high-profile speech that he gave about continuity of care and named clinicians. But it spread right through the NHS to even medical students running campaigns, nursing students. The Society of Radiographers have had a big campaign going, and individual trusts across the NHS, including mental health trusts, children's hospitals, normal acute trusts, community healthcare. It's everyone, and I guess that's the deceptively simple idea that it does affect everyone. Anybody who provides healthcare should be doing this, and I think that's why it's been sort of struck a chord with so many people.
So if you could pick one thing that people within the National Health Service could do differently as a result of Hello, My Name Is, what would it be?
So I think if the campaign sort of has one major effect on healthcare, I would like it to be that everyone who's providing healthcare thinks of their patients as people, and not just numbers or statistics, conditions or diseases, that behind all that there's a person with their own life, with their own priorities, anxieties and fears. And I guess that's the whole thing about Hello, My Name Is it's about providing truly patient-centered care, and that's what's behind the campaign. It's not just about introducing yourself and that one thing that starts off an interaction. It's about the whole wider issue of providing patient-centered care. So it's taken a lot of energy over the last few months to keep the campaign going, and to keep people interested, and to go off all over the country giving talks, and even spending a lot of time in Leeds talking to our staff. That energy is coming from somewhere, and I think it's about creating a positive legacy from my illness. I'm determined not to be the tragic young doctor who died of a rare cancer. I want to be the person who inspired a change and a shift in the NHS culture, to improve things and to really make the experience of our patients better. And I guess every day that I feel poorly and I feel that maybe I can't get on and do something, I remember that, and it keeps me going.
If you were to give 3 pieces of advice to somebody new starting in the health service, in any role, what would that advice be?
So if I was to give advice to anybody starting in the health service in any role, I think it's we are very privileged to do the job that we do. We're let into people's lives at the most vulnerable time of their life, a lot of the time. So we need to remember that we're doing this job for the benefit of our patients, and patients are the centre of everything we do. And that can even be, anybody doing anything to help a patient. We need to remember that. So if somebody looks lost in the corridor, then helping them to find where they're going. If somebody needs their water jug filling up, then remembering as a doctor you can do that as well. Or taking an older patient to the toilet, you can do that as well as a nurse can. And remembering all those little things really matter. And patients remember the little things. I remember when somebody's stopped and had enough time to talk to me about a problem, or somebody's had enough time to help me with my pain, or deliver bad news in a nice way, or look after me when I'm poorly, and recognise when I'm vulnerable and frightened. I remember those things, and those little things really do matter and probably make the biggest difference to our patients. We can all do them and they don't cost any money, so we should all do them.
And just getting back to the NHS more broadly, do you feel proud to work for the NHS? People don't always appreciate it, some people do, but how do you feel about working for the NHS?
I feel extremely proud to be a member of the NHS. It's an amazing organisation that does amazing things every second of every day. It's just awe-inspiring to think about the amount of healthcare that is provided. I'm even more proud of it because of what it's done for me as a patient. I dread to think where I'd be without a health service. The bill in America was $30,000 for just a few days in hospital, so what my bills would have run up to now after 3 years of healthcare fairly regularly, I really dread to think. So I am extremely proud of it. I think we need to reflect on what things are going not so well and improve them, but I think there's an amazing energy in this organisation that we can do better, and we will.